Straight teeth and a beautiful smile radiate confidence, self-esteem, and success. Some people are born with perfectly aligned teeth. For the rest of us, orthodontics delivers the promise of straight teeth and a transforming smile. Straight, well-aligned teeth are easier to clean and maintain. This means you avoid abnormal wear of tooth surfaces, difficulty in chewing and speaking, and excess stress on supporting bone and gum tissue. Increasingly, adults are turning to orthodontic treatment for personal, social, and career reasons. Let's face it, a person with a beautiful smile is perceived to have an advantage over someone with crooked teeth and a pronounced overbite. Not happy with your smile? Do something about it. Use our Find an Orthodontist service and make an appointment today.
Braces is the name given to the family of devices used to align teeth and address form and function. Today's braces use less metal than previously, or no metal at all. Some braces are barely visible. White ceramic brackets are made from composite materials and blend in with natural teeth. Rubber bands that hold the arch wire to the brackets are clear. The braces are almost invisible. Unseen metal braces may be applied to the backside of the teeth. These braces are called lingual because they face the tongue. Not appropriate for all cases. Ask your orthodontist. Clear plastic aligners are a series of contoured trays worn over the treatment period. Orthodontists may apply traditional metal braces to fine-tune the correction.
Healthy teeth and a killer smile are within reach of nearly everyone. Visit your orthodontist and discover treatment options to meet every need and every budget. Many orthodontists offer flexible payment plans so that your investment is comfortably spread over the duration of treatment. Orthodontic treatment is for children, teens, and adults. More orthodontic offices are assuring privacy for adults and offering evening and weekend hours to accommodate their busy schedules. The American Association of Orthodontists recommends that the latest a child should be evaluated by an orthodontist is age 7. The first molars erupt by age 6. The teeth may then be evaluated to see if there could be a problem in the future. For over 100 years, orthodontists have been the choice of millions of Americans for treatment to create straight, well-aligned teeth as well as healthy bites. To become an orthodontist requires successfully completing 4 years at an accredited dental school, followed by 2 to 3 years of specialist training in orthodontics. Only those dentists who successfully complete specialist training are entitled to call themselves orthodontists. And only orthodontists are eligible for admission to the American Association of Orthodontists. Orthodontists understand tooth movement, orthodontics, and the guidance of facial development, dental facial orthopedics. Dentists do fillings, crowns, dentures, cleanings, and whitenings. Orthodontists do one thing, and we do it well. Straighten teeth to assure optimal form and function.
More and more adults are seeking orthodontic treatment these days for several reasons. First off, we're living longer, so it's become more important to maintain our teeth for the years to come. And as well, patients are developing a better understanding of the importance of good dental health. I mean, let's face it, we are no longer in that generation of adults who lost most of their teeth before the age of 50. And the bottom line is, adult orthodontic treatment is more affordable. More and more adults are getting dental insurance that has adult orthodontic coverage, or they have flex spending plans that give them the funds necessary to pay for treatment. So basically, adult orthodontic treatment is more affordable and more attainable these days. One myth that I hear from adults seeking orthodontic treatment is that I'm too old for braces. In fact, I hear that all the time. Nothing could be further from the truth. Healthy teeth can be moved at any age. In fact, in my office, I treat patients in their 20s, 30s, 40s, 50s, 60s, and beyond. In fact, 1 in every 5 orthodontic patients in this country is an adult. Another myth that I hear is that, you know what, people that get braces, they're just vain, all they care about is their appearance. Once again, not true. Most orthodontic patients, adult orthodontic patients that is, that come to my office are concerned about changes that are happening in their bite. They're noticing that their teeth are starting to move and it's becoming difficult to keep clean. Their dentist is talking about things like gum recession and bone loss. So they realize now that they have to take care of their teeth, they've got to put them in a good position, they've got to have them last for the rest of their life. That's why they're in my office. As an orthodontist, there are several things that we have to take into consideration when treating adults versus treating children. Adults aren't growing anymore, and so their jaws aren't growing anymore. You see, my job as orthodontist is to get your teeth from A to B. And sometimes in children, we use jaw growth to accomplish that. But with adults, we don't have that option, so we really have to treatment plan to accommodate for not being able to do that. Another thing is, as we get older, our bones get harder. And so it becomes a little bit more difficult to move teeth from A to B, but you can still do it with a little bit more effort and a little bit more time. Another big thing is with adults, a lot of times the orthodontist has to take a team approach to getting you that beautiful smile. That is, he's going to work closely with your dentist, your periodontist, that's the gum and bone specialist, and the prosthodontist, that's the person who restores your teeth. The point being is he has to act like the quarterback and just to make sure that everybody's game plans are coordinated to give you the optimal result and the beautiful, healthy smile that you want. When it comes to an adult's reaction after braces are off or the orthodontic treatment is completed, well, it's just plain ecstatic. In fact, the three most common things that I hear from patients are, "Doc, I couldn't be happier with my smile." Or, "You know what, treatment wasn't as bad as I thought it would be." And most important of all, "I wish I did this sooner." For some adults, getting their braces off or completing their orthodontic treatment is such an emotional experience. It's a wonderful sight to see. You have to remember that some of these patients have been embarrassed by their smile for quite some time or have been really concerned or self-conscious about the appearance of their teeth. And now they have the beautiful, healthy smile that they've always wanted, and it's just transformative. The change in self-esteem, the change in confidence, they're walking to my office smiling and talking to everybody. It's a transformation that every orthodontist loves to see, and the patients are just ecstatic, and they couldn't be happier, and they're so grateful that they went through the process. Over the past several years, there have been some major breakthroughs in orthodontics that really apply to adults. I mean, let's face it, adults are concerned about their appearances when they're going through orthodontic treatment. How are braces going to look? I'm a businessman, I'm a school teacher, can I really do this? Well, one of the breakthroughs that we have now is clear aligners. Orthodontists are using clear, almost invisible aligners to move teeth. So think about it, you can be talking to someone and they're not even aware that you're going through orthodontic treatment. And for those people that can't use these clear aligners, there's braces. And braces are smaller than they've ever been, and these days we now have tooth-colored braces that are very discreet and very aesthetic. And another option, something called lingual brackets, braces that in fact go behind the teeth. So once again, you could be out there in the public and no one is aware you're going through orthodontic treatment. Another big concern for adults is time. Let's face it, we're a busy society with a tight schedule. Well, these days with the advances in brace technology and wire technology, orthodontic treatment is more efficient and effective than it's ever been. What does that mean for you? Well, what that means is you're visiting the orthodontic office less often, you're spending less time in the office, and as well, treatment time is a lot shorter these days. So really, time and appearance is no longer a concern with orthodontic treatment. Another major breakthrough in orthodontics is the use of something called TADs, temporary anchorage devices. These are little appliances that we can use and attach to the jaw to help us move teeth in ways that we've never been able to before. In fact, in some instances, it allows us to avoid more invasive procedures. One important thing that an adult should take into consideration is that with these medical and dental breakthroughs, they're only as good as the expert who's using them. That's why it's very important that when an adult feels that they have an orthodontic problem, that they see an orthodontist. Keep in mind that an orthodontist is a dentist who has received 2 to 3 years additional specialized training beyond standard dental school education. If you feel you have an orthodontic problem, it's really important that you see an orthodontist who can properly diagnose the problem and who has kept up on the current technologies so that he or she may help you choose the appropriate treatment plan to deal with your bite.
Many people today are looking for ways to improve their appearance, and often we hear about cosmetic dentistry. Cosmetic dentistry refers to any procedure that would enhance one's smile, and generally we're speaking about whitening, bonding, veneers, and crowns. Our society or culture is very focused about appearance, but we're also looking for that quick fix or instant gratification. But often a lot of these makeovers or cover-ups neglect the importance of health and camouflage underlying problems. Everyone wants straight white teeth, but what's the best way to get there? There may be several options for patients to consider in improving their smile, and they need to weigh and measure the pros and cons associated with those procedures. Risk factors, cost, time element, all need to be considered in making the best decision for a long-lasting result. To look at cosmetics alone would be like putting siding on a house that has structural flaws or new tires on a car that's out of alignment. The focus of orthodontics is to get great function and also to give us a beautiful smile. If one has a bad bite or a malocclusion, due to the fact that the teeth or jaws are not in good position, and they opt for a cosmetic fix alone, they may be jeopardizing or compromising their successful result. So it's very important to understand what the problem is before undertaking a solution. If your teeth have shifted and worn down over the course of time, it may be unrealistic and not in your best interest to choose a quick fix. Often it's much better to see an orthodontist to have the bite addressed so that you can have a great smile and a lasting result. A good solution for many patients is a team approach. Especially with adults that present with complex problems and issues, often orthodontists, general dentists, and the various dental specialties collaborate to achieve amazing results that otherwise could not be accomplished alone. Orthodontic treatment is certainly very affordable and may be one of the best values in healthcare. And considering that certain cosmetic procedures may be subject to failure, breakage, and there are maintenance issues, orthodontics in the long run may be less expensive. Many patients are pleasantly surprised and amazed at the outcome of their orthodontic treatment. Orthodontics may, in many cases, actually eliminate the need for certain cosmetic procedures or minimize the amount of dentistry that needs to be done. Most people value and appreciate the significance of a great smile, but the goal in achieving a great smile should be an aesthetic one and not just cosmetic. Aesthetic meaning beauty and function, natural, long-lasting, health, stability, comfort. All dentistry should be aesthetic and respect the fact that we're dealing with a biological system and not just 6 front teeth. Patients shouldn't have to trade health for beauty, and they don't need to. They can have it all. See an orthodontist for a great smile.
Some of the common problems I see in children are crossbites. A crossbite is when the upper teeth fit inside of the lower teeth, and this can occur either in the front or the back of the mouth. When it occurs in the back of the mouth, what commonly happens is that when the child tries to bite down, their jaw ends up shifting over to one side. And this can cause potentially problems in the future, not only with their joints, but also with growth asymmetrically. When you have a crossbite in the front teeth, this is what's more commonly known as an underbite. And what happens there is that now the upper front teeth are fitting inside of the lower front teeth. Another common bite problem we see in young children are open bites. And what this is that when the child bites down their back teeth, their front teeth do not overlap and they're still open. You can kind of see their tongue through that hole. And this occurs from either thumb or finger sucking, and it can also occur from a mouth breathing pattern or habit. This is something that you would want to get addressed and evaluated by an orthodontist, because the problem does not self-correct, as for the child to swallow, they have to actually put their tongue through that hole, making the problem worse. Another common problem that we see in young children are deep bites. And what a deep bite is that the top teeth overlap the bottom teeth too much, and when the child smiles, you can't see as much of the bottom teeth as you would like. This is something that you would want to get evaluated by your orthodontist to see if treatment is necessary to help facilitate the correction of that problem. Crowding in children is not always an indicator of orthodontic treatment. A certain amount of crowding in children is actually quite normal, as there is a size exchange that occurs as children develop. For one, as the adult front teeth come in and replace the baby teeth, they're actually bigger than those baby teeth when they come in, so there's going to be some crowding. However, later on, as the child is developing, the baby molars are actually bigger than the adult teeth that succeed them. So there is an exchange of space that occurs in addition to the child's growth of their jaws that helps alleviate some of this crowding. However, an orthodontist would give you the best opinion on that to determine if your child does need any treatment to help alleviate their crowding. It's not always easy to know if your child needs braces or not. Some signs or habits that you may look for are finger or thumb sucking. If your child is a mouth breather, that could be of some concern for bite-related issues down the line. Early or late loss of baby teeth or even missing baby teeth can be an issue. Are their jaws in proportion with the rest of their face? Something else that is an indication for orthodontic treatment are joint sounds, meaning when they open or close their mouth, do their joints pop? Do they make sounds? Or do their jaws shift upon closure? That could also be another sign for orthodontic treatment as well. American Association of Orthodontists recommends that all children be seen by an orthodontist no later than the age of 7. An orthodontist has 2 to 3 years of extra specialized education beyond dental school, giving them the ability to pick up on subtle problems that may present in your child at an early age. Some of the misconceptions that parents may have about bringing their child into an orthodontist at an early age are that, for one, that they need a referral from a general dentist, and this is not true. Many times parents can anticipate that something is going on with their child's bite or jaws, and at that time should bring the child in to see the orthodontist. Another misconception I find is that parents wait for all their child's adult teeth to erupt. And again, by bringing your child into an orthodontist at an early age, you are allowing the orthodontist to make a decision as to whether or not treatment is needed in the first place, but also that if treatment is necessary, when is the appropriate time for that to begin. At the first appointment, orthodontists are looking for several factors. When the child comes in, the orthodontist conducts a quick and easy exam where they're evaluating namely the patient's face initially to look at the direction of growth of the jaws and to see if they're growing in proportion to each other. And we're looking at the child's teeth. Does the child have a deep bite? Do they have a cross bite? Do they have an open bite? Or do they have spacing or crowding of their teeth? And is the issue severe enough to indicate orthodontic treatment? Most children, if treatment is needed, will actually start orthodontic treatment between the ages of 9 and 14. It is rare but not unheard of that some children might receive orthodontic therapy before this age, depending on their needs. Depending on the case, some of the new breakthroughs available for children today include brackets that are small and sleek that can either be tied in with colorful elastics or that actually can close on their own. Additionally, depending on the child's case, the child may have ceramic brackets, which are the color of their teeth, or they can have plastic aligners to straighten their teeth out as well. My job as an orthodontist is to give my patient a beautiful smile. And my patient's motivation and compliance throughout treatment is essential to making that happen. If I find that my patient starts to not follow instructions as well, what I generally do is show them pictures of what can happen and the consequences of not following instructions properly. Compliance does not end after teeth are moved into their final position. There is a stage of orthodontic treatment called retention, where if necessary, your orthodontist will prescribe you retainer wear. If your orthodontist does prescribe you retainer wear, it is essential that you follow his or her instructions. There are many benefits of orthodontic treatment for children. There's obviously an improvement in not only the way their teeth fit together and their ability to chew, but also in the child's ability to clean their teeth, which is important for the long-term health of their teeth. Additionally, many children find a boost in their self-confidence as they have more comfort in their ability to smile.
Over the past 25 years, braces have changed a lot. If I think about it, it really has changed from two aspects. The first aspect is that braces used to be considered a luxury. And as a luxury, only very few patients had an opportunity to have braces. Today, braces are part of an important overall dental health care plan. And of course, the second area that braces has changed is in terms of technology. Because as we know today, braces are smaller, they may fit on the outside of the teeth. They may fit on the inside of the teeth. Sometimes they're tooth colored, and sometimes they're clear so you don't even see them at all. If we go ahead and look at those that are fashion conscious, they may decide to use colors or different shapes. And if you couple that with the new technologies, the memory wires, that makes braces not only better looking, but more comfortable and quicker.
When my father began practicing in the 1970s, all of the patients had the old school railroad tracks type of braces, the braces that wrapped all the way around the teeth. And most of the patients were children. Now, patients have miniature metal braces, they have clear braces, they can have enamel-colored braces, braces that are affixed on the insides of the teeth or the outsides of the teeth. And some patients don't have braces or wires at all. They have clear plastic aligners, which are very popular. And in the hands of the orthodontist, can get excellent results.
You know, Katie, you've really hit on an important point there, because it's really not so much just the technology that we're looking at, but it's really the person using that technology. Few people realize that orthodontists receive an additional 2 to 3 years of formalized education beyond dental school to learn the proper way to align and straighten teeth and jaws. They also focus their continuing education throughout their careers on orthodontics alone, so that they can provide you with a good smile with the latest kind of technology. We tell people that are looking for an orthodontist to go to braces.org. braces.org, because on that website you're able to find orthodontists, people who've had the education required to give you that new healthy smile that you're looking for. Katie, I think one of the big changes that we see is how orthodontics is going to fit in today's busy lifestyle. It's really a question of convenience. Children patients start school earlier, they're busy before school, during school and after school, have difficulty coming in. Our adult patients are busy at work and they don't want to miss work in order to have their orthodontic visits and checkups. And orthodontics has evolved, so patients have to come in less often. When I started out in practice, we'd see patients every 1 to 2 or 3 to 4 weeks at a time. Now our patients come in once every 6 to 8 weeks, and sometimes they don't come in for appointments but once every 10 weeks.
Another big change has to do with the affordability of orthodontic treatment. In the 1970s, the cost of braces was similar to that of a mid-sized car. Now it's a fraction of that cost. Couple that with dental financing options, insurance coverage plans, and flexible spending accounts, braces treatment is more attainable today than ever before.
Convenience and affordability. 6 out of 10 patients today that are having braces have some kind of dental insurance. And the fact that orthodontics, dollar for dollar, costs less today, there's really no reason that somebody that wants to have a beautiful, healthy smile can't have one. All they have to do is call their orthodontist.
Many adults are opting for orthodontic treatment for a variety of reasons. Healthy straight teeth are ageless and attractive, and more adults are realizing that there's a connection between oral health, a healthy smile, and overall health. More specifically, some have seen a child have a beautiful smile, and that's what they want for themselves. Also, some adult patients had treatment as a child, and they come in for a tune-up, like myself.
Well, Katie, when I started out in practice, we had very few adult patients. And part of that was that patients just didn't come in as adults and ask for treatment. We know that teeth can move at any age. And today, with the new technologies, we can provide adults with cosmetic, aesthetic braces from which they can get a good-looking smile. And whether it's a small change that they need for a maturational misalignment of their teeth, or it's something where they need a major change, they're able to get a beautiful smile as we're able to move teeth with a variety of different kinds of braces.